Good evening. This is Dr. Ushyendra, and I am just briefing you all about the hypertension, its definition, its how it can be controlled, and what are the lifestyle changes you need to follow. So basically, hypertension is, as you all know, recording when the systolic is 140 and diastolic is 90 millimeter of mercury, and we have to rule out many of the underlying processes like endocrine hypertension, essential hypertension, then age-related hypertension, and other conditions which we have to diagnose, and after that we have to treat after investigations. So how we can prevent? Prevention basically is low salt intake, fresh fruits and salad we have to take. Then we have to go for investigations like RFT, LFT, electrolytes, different endocrine profile, thyroid status, then other conditions we have to rule out. So how can we treat? So when we have to treat, we have to take into consideration if any other chronic processes are there or not. So what we can do in chronic processes to rule out is whether the patient is having CKD, then whether patient is having CLD cirrhosis, and whether his patient is having CAD or alternative other conditions. So what are the choices we have for treatments? The treatment choices we have is amlodipine, this other ARBs, CCBs, calcium channel blockers, other calcium channel blockers. Then ARBs, we have telmisartan, olmesartan, azilsartan, even valsartan, and segobrel combination is there nowadays. And then we have this uh, diuretics as well. Then we have different classes of thiazide-like diuretics. This triamterene, amiloride, then this other metolazone is there, chlorthalidone is there. So this is very important. We follow this active guideline for hypertension management. How to manage complications? Definitely, we have to go for statin usage in different age groups according to different doses. This whether we can start rosuvastatin, whether we can start atorvastatin. Ezetimibe is very good. Now the bempedoic acid, another new drug is coming. And if when the patient is having sugar diabetes, we have to control that. So chronic processes are very important to control. Instead of directly jumping on to the treatment, we have to follow first active lifestyle, and then we have to start treatment, and then we have to start the complications management. Yeah, this is all in brief about hypertension management to check your BP of 140 by 90 or less. Thank you.